despite ongoing efforts to roll out the COVID-19 vaccine to the minority community, there are still a great number of African Americans who are wary about getting the shot.
It truly shows in the number of people vaccinated across Virginia and, for that matter, many other states as well. 10 on Your Side's Tamara spoke with leaders who say this stems from deep-rooted mistrust.
According to the Virginia Department of Health, more than 600,000 white Virginians received the vaccine in January, while only 100,000 black Virginians received it. It's a big difference, and local leaders say the disparity can be traced back to generational fear.
I'm really kind of afraid of what the reaction is going to be, which is most of my black and brown community people are afraid of.
Fear. It's what's keeping people like Nadaline Ross from signing up for the shot.
I have like 20 plus grandkids and 7 kids and 3 of them out of state. I want to see my children. I don't want to be alone all the time.
But she's fearful that the vaccine could harm her, and she questions the rapid nature of the rollout.
I'm not going to do something that I don't know nothing about. I'm not going to risk my health already is at risk.
It's a fear Hampton University president Dr. William Harvey says has deep roots.
Some of it is the fact that there's just this distrust. For example, I talked to so many people that talked about the Tuskegee study, and that to me was a shame on this country.
The Tuskegee study was a 40-year experiment involving hundreds of black men infected with syphilis. Researchers told the test subjects they were being treated when in fact they were not. Mistreatment of the black community can also be found in stories like that of Henrietta Lacks, whose cervical cancer cells were harvested from her without her knowledge and then used to advance medicine.
The fact is that there was trust in the federal government to try to be helpful to African Americans. So the trust factor was betrayed, and there's no question about it.
So Iris Lundy, director of health equity for Centera Healthcare, says they have to start by gaining that trust back.
We have to acknowledge it. We need to say, yes, there are wrongs that have been done against minority communities.
Next, they have to be transparent.
Let's have this dialogue. It may be uncomfortable, but let's just roll up our sleeves and go ahead and have it. Let people ask their questions. Let's give honest, transparent, accurate information to the best of our knowledge to answer their questions.
And finally, make an example.
When I look at our leaders who are rolling up their sleeves and they're doing it, I find comfort in that, and it helps me to roll up my sleeve also, which is why I'm going to get my second shot today.
And Dr. Harvey got his shot.
I had 0 side effects, and I'm very pleased to have done it. I'm very pleased to have provided some leadership. I'm pleased because I do believe that the only salvation for this pandemic is these vaccinations.
He encourages everyone to take a break from social media and talk to your healthcare provider or do your own research. Nadaline says it's that information that she believes could bring her closer to seeing her grandchildren again.
Now that I know what resources I can go to find out more about them. I did not know about the CDC. A lot of the stuff you're telling me now, I did not know. Where I could go to find information. Now I can pass this on.
Dr. Harvey and Iris Lundy agree bringing access and information to lower-income, underserved communities is a priority, and it's what will make the difference. They're working to make that a reality, and Dr. Harvey is working to make Hampton University a testing and vaccination site. Tamara, 10 on your side.